I'm Heeyoon an associate professor at Hanyang University in Seoul, Korea. I would ask you understanding, so I prepared a 5-minute presentation, so I will skip some slides without mention. We seldom meet today I would like to talk about the endogenous endophthalmitis. We seldom meet the patient with the endogenous endophthalmitis at our clinic. As you know, this disease is very sight-threatening disease. We must keep in mind suspicion of this disease for early diagnosis and treatment. So it is, we will skip. Okay. My colleague and I reported a study regarding the endogenous endophthalmitis in Korean population. So according to this study, we showed the patient, more than 30% of patients had visual improvement. The most common causative organism is Klebsiella, and the source is liver abscess. Depending on the region of the world, the clinical features vary with respect to the source of infection, causative organisms, predisposing conditions, and visual prognosis. Most studies were performed in specific geographic areas. There is no literature comparing the different regions. We compared the clinical features and then in sample patient population from the United States and South Korea over an 8-year period. In total, 128 eyes of 108 patients with the endogenous endophthalmitis were included. So for the treatment, the vitrectomy with systemic and intravitreal microvirus were performed in 39 eyes in the American population and 30 eyes in Korean population. There are many predisposing medical conditions. In America, intravenous drug abuse and diabetes were common. In Korean population, diabetes and hepatobiliary disease were very common. The extraocular infection source leading to endogenous endophthalmitis were identified in 86% in American patients and 75% of Korean population. Endocarditis was diagnosed in over 7% of American patients. Overall, the liver abscess was most common in Korean population also. The visual prognosis of American patients were better than in Korean patients, and this data showed that fungal endophthalmitis showed a better prognosis than in bacterial endophthalmitis. We analyzed the prognostic factors associated with poor visual outcome. The presenting visual acuity and etiology of the infection were the prognostic factors. The Klebsiella showed the poor prognosis. Considering the subset of endogenous bacterial endophthalmitis in both populations, 40 eyes underwent vitrectomy. There was no difference in final visual outcome between vitrectomy versus no vitrectomy group. But however, this study is a retrospective study. There was a significant difference of baseline visual acuity between two groups. So we analyzed the visual outcome of endogenous endophthalmitis with a highly virulent pathogen according to the presenting vision and treatment modalities. We can find the usefulness of vitrectomy for the endophthalmitis caused by highly virulent pathogen. So the reason for different clinical features in two geographic areas could be genetic and or environmental. We found that the causative organisms were similar to other previous studies. Although this disease is generally associated with poor visual outcomes, our series showed that the visual prognosis was strongly influenced by presenting vision and the underlying pathogen. The usefulness of vitrectomy, we feel vitrectomy will be useful, but for the treatment of endogenous endophthalmitis is still controversial in this study because of a lack of a large randomized control study, but many studies suggested vitrectomy may be effective modality for the diagnosis and treatment. In this retrospective study, vitrectomy was not associated with a better visual final outcome, but showed that it may be helpful in cases of a highly virulent pathogen presenting with hand motion or worse vision. There are the limitations of a study. I would like to give the meaning to our study because it was the first multi-center study to compare clinical features across different continents. Thank you. Thank you for your attention.
I think the problem with endogenous endophthalmitis is timing.
Yes.
Because the acute post-operative, you follow the patient, you see the patient the following day, the first week, but those patients are actually healthy patients or sick patients, and they either start complaining and complain and complain, and they are referred later, quite late.
Yes.
And so the Klebsiella patients, they come very late, and it's too late to do anything. The Candida patients are more, I think, luckier, because this is a very slow-growing organism, so you can really salvage the eyes. But I think the message is, you have to take the patient early on in order to finally reach something. And those patients who have been either in the intensive care, because many are diabetics who have been in the intensive care for, I don't know, for a cardiac problem, or they usually get this problem later on. So a very high alert and suspicious should be taken into consideration. Thank you very much.
Thank you. That's the point that we must keep in mind for suspicion.
So no further comments? Yeah?
From the board.
One thing I see in patients with endogenous endophthalmitis, and I don't know if that was noted in this study, is patients with bacterial disease are usually too sick for surgery to do a vitrectomy. And the problem with Candida endophthalmitis, they just do not turn up again. They either die or they disappear. Was that something you saw as well?
According to my memory, it's less than 10%. We cannot follow up the patient because their severity of the systemic disease. But we must keep in mind one more. So we, regarding the exogenous endophthalmitis, we can fight with only eyes, but in cases with endogenous endophthalmitis, we need to help from other doctors, internal medicine, or the intervention of a systemic disease, and then we must fight with the eyes and body together. So sometimes, but you know, the current medication and current surgical intervention is developing, so more patients with a systemic disease will survive. So we must focus on the eyes as soon as possible.
Do you think there were differences in the indication of surgical adjunctive surgery? Because everyone gets systemic therapy, but when to start vitrectomy, that might be different. Do you have any hint whether the indication were different in Korean and American population?
Sorry, could you one more ask me?
The question was, do you think that the indication for surgery, that might be that it could be different in the American and in the Korean patients? Do you think that is the same?
In my opinion, vitrectomy is very important for early diagnosis as well as in Korean population as well as in American population. I think it's the more important thing is not ethnic diversity. I mean the early diagnosis and the causative organ is more important for prognosis.
So one final point. In this case, vitrectomy is also a useful diagnostic tool, because sometimes you get patients that are otherwise healthy. For example, patients affected by Candida, let's say, are otherwise healthy. They have uveitis or an endogenous endophthalmitis, and you can actually diagnose and then search for other locations in the body of the infection. So it also has a useful diagnostic.
I totally agree with you, but our data did not show the evidence supporting the usefulness of vitrectomy, but limited usefulness in highly virulent pathogen.